Dr. Coslip-Pacheco, this question is for you. When it comes to maternal vaccinations, perhaps for mothers, as we've been talking about earlier, who may be seeing conflicting headlines around vaccines, how do you explain to them that vaccines are safe and can influence protection for their babies?
Well, I start out by saying to them, the first thing I say to them is, can I discuss vaccines with you? I've never had a mother say no to me. That's kind of empowering for them to hear from a provider asking for permission. And again, I'm speaking from the nurse perspective. Then I ask them, what specific questions do you have about the vaccines? And when they come up with the questions, I ask them, well, where did you hear the information? And then I say to them, well, let's look at that together, where that information came from. The things I'm looking for is who published it, where was it published, who funded it. And a lot of times I can poke holes in what they've heard by just asking those questions, but always kill them with kindness. Like I mentioned before, it's not their fault. They're being sold all of this garbage because there's a lot of money in the anti-vax community and they're making a lot of money in addition to what they have already. So it's also empowering the mother to be able to say to me, yes, I want to hear you, or no, I don't want to hear you. And like I said, I've never had a mother say to me, I don't want to listen to you. And then I go through the vaccine itself. I also like to give them examples of patients that in my own family on things that I've seen. I talk about my mother having polio. I talk about that with the hepatitis. I talk about that 4-year-old cousin who died from hepatitis years ago. That when was the last time you heard of a child dying from hepatitis? I talk about whooping cough and how in our county of Suffolk, it's rare when we don't have at least one case of whooping cough somewhere. I talk about influenza and how important it is for the mom to be vaccinated with influenza um, to protect the baby because the baby's too young to get the influenza vaccine until they're 6 months old. I talk about the differences between giving the mom the um, the RSV vaccine before the baby is born. That baby will be born with the antibodies, and if she chooses not to do that, why it's important to give the baby it's not and tell her it's not a vaccine. This is preformed antibodies that will immediately start helping the baby to prevent RSV. And then I tell them about the babies that I saw in the hospital that got RSV. I tell them about my own children having had RSV and why I think this is so important. Um, but all the while, it's a dialogue. As I give them a piece of information, I pause and ask them if they have a question. How can I answer that question for them? Let's go on the internet and look at what the sites are where you found the information. A lot of times, just sitting with them and showing them where the information came from and how to what we call appraise the information, but giving the mom the tools to be able to do that herself makes a big difference. I don't always win on the first trip, but a lot of times I win the second or third time around.
One of the things that I see the American Academy of Pediatrics as well as others is that they're now posting videos. There are some videos of families whose child had an illness, and there's some videos of pediatricians talking exactly as Mary said, what's the information, not calling it data, not using fancy scientific terms, but talking about the differences on the vaccines and why we use it in that kid in that time. And I think over the next few months, we will see many more of these videos, and they can be used in physician offices, be put on a loop on the television, a little, QRL code to give to the family that they can look at it while they're in the waiting room. And I think that will help. My worry is I hear some of us talking is that most of the pediatricians out there don't have the time, such as Mary's talking, to do that kind of lengthy discussion. So I am hoping that these short videos and the QRL codes where the parents can watch the video at home are going to make a difference. Do I think it will be a huge change? I don't know, because we are battling a huge onslaught or tsunami of bad information. So those little drops of good information may be overwhelmed, but at least we're starting to do that now.
And sending them to those good websites too, because we pediatric folks have a lot of really good websites. American Academy of Pediatrics has some wonderful things. Vaccinate Your Family has wonderful things. Voices for Vaccines has wonderful things. Children's Hospital of Philadelphia has wonderful things. But as Dr. Nachman said, these are little short sound bites that you don't have to sit for long hours through. And honestly, this is a real challenge for pediatrics. We are now faced with spending all of this time to try to educate our families, and there's no reimbursement for the pediatricians. It's really tough. Time is money. We want to be able to make sure that we see all the children, but to have to try to do this in this teeny tiny amount of time with no reimbursement is really very difficult for my pediatric colleagues.
I agree. I think, and I'll speak from the standpoint of someone I've never had children. So I'm also very transparent about that as I educate, quite similar to the other examples provided. Because I have not had children, I do start with that disclaimer because I never want to recommend something that I myself have not had to explore for a young child. And I think that's a very important part as well, because I'll often have moms when I do give them education that will ask me if I did that for my child. And I'm very honest about the fact that I have not had to navigate that. So if for our folks that may get those questions, transparent honesty is the best policy and transparency in that regard. I think for me, and of course, every community is different. I've worked with my community since the COVID-19 pandemic, and we've done a lot of education. We traversed a lot of things together. So I don't mince the science when I bring it forward. I'm very transparent about what the scientific process is. They can probably talk to folks, they can probably tell you what a randomized clinical trial is better than I can at this point, because I've worked to make them stakeholders of said information. I want them to be able to have that agency and to understand someone can give them a lay terminology of what's happening and they can tell them scientifically and they know the information that they're receiving. I want them to really be agents and be able to advocate for themselves. So that's how I approach that. But when I do talk to moms about the data, I bring forward the clinical data that we do have because I want them to know that, we do represent in some way that maternal process and young children, and what it is that we do, even if it's a matter of me saying, you know what, it wasn't on humans, but they did it in rats. And I will describe animal biology and what it is that we can derive from that as we take that information. And if we go ahead and recommend that in a mom, this is why. So I really try to take that time to make sure they have that information. I'm a pharmacist. I work in very many different capacities, but I think that, when we talk about the limited time that our providers, the various levels that exist, physicians, our nurse providers, and so on, that practice, they have limited time there. So what we can do is we can extend that. We can make that recommendation from the various capacities of medical professionals that people interact with. I think that's so important for us to have a coordinated approach, but not to let the recommendation lie solely on one discipline's shoulders. That is a lot for that one discipline to carry. And there's always going to be an opportunity for something to fall through the cracks. So I think now is the opportunity for all of us, irrespective. I mean, and I think a lot about my public health colleagues, that really work in preventative care, how it is that we can coordinate our communication approach to ensure that everybody, irrespective of wherever it is that you receive care, can have information about these vaccines and why they're important.